The first promising ALS drug in 20 years has just been approved in Canada. It's shown potential to slow progress of the fatal disease. Karina Roman is here with the details. Hey, Karina, nice to see you. What do we know about this drug?
So we know that it works best in the early stages of the disease where you haven't lost a lot of motor function yet. It doesn't reverse what you've lost. If you have stopped walking, that's not going to come back. So it works better before you've lost all that because it can slow the progress of that the deterioration. We also know that it's the first new drug for ALS in almost 20 years in Canada that show this kind of promise. So the one that has been used up to this point would extend people's lives by maybe about 3 months. So this is definitely a big breakthrough for ALS patients. But people have had to go very far to get it because it was approved in Japan. That's where it started. And I talked to one woman who spent $45,000 going over to Japan to buy it, to come back, to bring it back and take it because it wasn't approved here. So, you know, it's definitely been like a big deal to the patients to see this hope and not be able to get it here. It's interesting, though, that this approval has come on the heels of much bigger publicity on the Hill about ALS, because when Maurice Bélanger died, there was a group of MPs from all parties that formed an ALS caucus. Now, they will say, we have no influence in the approval of drugs, and I'm sure that's true, but certainly they've raised awareness by Health Canada as well that there was this pent-up demand for this drug. And so it went through an expedited review, which is a process they have for drugs like this, where it goes through for 180 days instead of 300 days. So, you know, that has led to today where they've approved the drug.
And what does the drug being approved actually mean, tangibly?
It means it will eventually be available in Canada, but it does not mean that it's available starting tomorrow in a widespread way, because there's this whole now new process where they have to figure out the price, who's going to pay, provinces, drug plans, patients, who's actually eligible for it, since it does work best for people in the early stages of the drug, of the disease. So unfortunately, it doesn't mean suddenly tomorrow all these patients have access to this drug. And that's certainly frustrating for some because there's no set timeline either. It could be months before that happens.
That's what I was wondering, is what's the earliest?
Yeah, the earliest, I've been told months, and that's very general. What does that mean? I talked to ALS Canada today, and they say not just for this drug, but for any drug that we're dealing with a disease that's so time is of the essence, that Canada really needs to do more work on streamlining the process so that you don't, not only, yes, 180 days feels very quick to review a drug, but there's still so much ahead. So they really feel like that's something Canada has to do to really help people who are in such a dire situation.
Yeah, especially not for the patient. 3 months is a lifetime.
Yeah, it is a lifetime. I mean, it was pointed out to me that even in that 180 days, you know, 500 people would have died, right? So it's definitely, this drug has lots of people very hopeful, but there's still a long road ahead.
Okay, thank you so much, Karina.
You're welcome.